This is my week 4 assignment for Community and Public Health, hca415, instructor Brandy Benton. It's December 18th, 2017, and I am Brittany McBee. Smoking is one of those issues that almost everyone has been affected by, whether you are a smoker or a non-smoker. Whether it be you lived during the time when you could smoke inside restaurants or walk past someone smoking outside. This is why different state governments are putting forth the efforts to enact laws aimed at monitoring smoking in their states, and the most known effort being a ban on public smoking. However, the regulations differ from one state to another. Some have thorough restrictions on smoking in the workplace, while others allow employees to smoke in designated smoking areas. It is not always that a smoker will observe such rules and repercussions to his visit to a company in another state and end up having to pay a fine for not observing the rules on smoking. Such variations call for intervention by the federal government to offer a solution that would ensure similarity in the rules across different states in the country. Smokers as well as non-smokers are bound to appreciate the intervention. Smoking affects almost every organ in the body, and most of the deaths in the country are associated to a health issue caused by smoking. Shields 2002. Not only does smoking lead to breathing complications, it affects the nervous and the digestive system. Passive smokers often have issues related to the smoke from the smokers and would rather live in an environment where the smoking zones are located a clear distance from areas where pedestrians are likely to pass through. Such citizens would wish that their local government imposed stricter smoking laws than those issued by the city in general. However, the notion that the local government cannot make laws more strict than the state government in such matters leaves no option other than to accept it. However, if the federal government intervened in the matter, they would be better equipped to conduct research on the interests of the public and determine an appropriate solution for the community's health overall. It's difficult to keep track of which each state rules are whenever it comes to addressing smoking. Such differences reduce the overall constructive impact of the legislation. Several states do not have any regulations on smoking, allowing people to smoke in restaurants and bars, with the chances being that they do not understand the danger that smoking poses to their health, or maybe they do not care. Atlanta, Fort Worth, Miami, and Las Vegas are just a few of the cities that still allow smoking. If the government understood the statistics on the numbers of deaths resulting from smoking in the country, then maybe it would open their eyes and they would be more proactive in reducing the extent of smoking through legislation. The federal government has a better understanding of such implications, being able to see the data necessary, which puts it at a better position of monitoring and addressing the issue of smoking in the country. Making active steps to prevent such adversities is a path the government needs to take in order to help the people. My proposed policy is to ban smoking in public areas. If we were to make it more difficult for people to smoke outside, then it would benefit everyone as a whole. If there were certain areas that were designated for smokers that would allow the pedestrians that did not want to be around it to steer clear of it, then that would be an option. More often than not, you are walking down the street, or maybe you're standing outside waiting for a concert in a line, and somebody in front of you will light up a cigarette. This will help prevent issues like that from arising. If the rules were not followed, there would be a hefty fine to follow suit. Federal policy always affects the state governments. In some cases, some states may be unwilling to provide full support of the policy in question. Such withdrawn support would imply limited effort in enforcing the implementation of the policy in question, even after the Congress vote passes it into a law. However, it is important to consider the effects of the law that it would have on the community. It is expected that those in the tobacco industry would be highly opposed to the policy since it has a likelihood of reducing their sales due to the reduced use of the same among the citizens. However, the common citizen is most likely to appreciate it knowing that it sets the stage for reduced use of drug by future generations. Limited contact between the users and the non-users while smoking would reduce the influence it has on a non-user in beginning using tobacco. Eisenberg and Balster, 2000. As I stated earlier, tobacco-related health complications are some of the leading causes of death. The fact that tobacco affects almost every major organ in the body is one of the reasons for the high mortality rate. A possible solution to the use of tobacco is, therefore, likely to result in a consequent decrease in the number of deaths in the country. However, to get to that position, it would require that people gain an understanding on the statistics. Such would be achieved in the process of publicizing the policy to be implemented. The high number of users in the present day is attributable to the limited knowledge of such effects of the drug. Once the people understand what is at stake, the chances are that they will seek help to reduce their tobacco dependence. This would lead to an eventual decrease in the number of health complications and tobacco-related deaths in the country. Following the public's awareness of the policy endorsement, the immediate effect will be a response by the tobacco manufacturers to try to convince the public of their commitment to having awareness across the country. In addition, the states with laws already in effect are more likely to have a say on the matter in an effort to try to influence the federal government into making laws that are not significantly different from those that they employ. However, the most significant change will be the society's awareness of the dangers presented by smoking and the reduction in smokers upon their knowledge of the harm to which they expose themselves by engaging in the activity. Human beings wish to live a long and productive life, and the fact that smoking puts us at risk is likely to get most smokers seeking assistance to quit the addiction. Therefore, a reduction in the number of smokers would be the most obvious change following the legislation. Every policy ratified by an entity impacts the stakeholders in different ways. In this case, the primary objective of the policy is to ensure uniformity smoking laws across the country. It hopes to reduce the chances of smokers getting in trouble with state or local governments due to their ignorance over the smoking laws in the different environments. Therefore, the primary beneficiaries of the policies could be termed as smokers, while the governments stand to lose a significant amount of revenue accrued from such incidences. However, since the different governments set the policies to curb public smoking and its effects on the citizens in the areas, then the idea of standardized approach to address the issues would be welcome, irrespective of the costs incurred in the process. Further, there would be a general decrease in health expenditure following the discussion and campaigns on the use of tobacco after ratification of the policy. However much the society stands to benefit from the policy, there are possible risks in nationwide policies on the use of tobacco. For example, there are areas where the residents have no regulation to what they would term as leisure lifestyle. Such individuals go to court seeking to bar the state from enacting the regulation on account of lack of not having any laws in effect to begin with. Notably, such legal proceedings can end up harming the intended results of the policy implementation process. However, there could also be the risk of the public who support stricter regulations terming the political class in the country as not being actively involved in the protection of the citizens' welfare. Once the public gets to learn of the dangers that accompany the use of tobacco, the chances are that it would be motivated to have the policy passed by Congress. As I stated earlier, the presence of different laws in various states and local governments is the motivation behind the policy. The effects of the tobacco users to the extent of encouraging them to quit are part of the indirect effect of the ratification of the policy. Therefore, their lives would be most affected since they would be in position to develop a culture that they would apply anywhere across the country with limited concern over the possibility of going against the state's legal provisions for smokers. For example, it's universally accepted that smoking in schools is wrong, and smokers try their best to not smoke within the school compounds. The culture developed across the country and resulted to be more disciplined for smokers while around children. Consequently, a universal law applicable to the entire country would work in the same way, and the government would be in a position to get smoking data from across the country for planning purposes than it would do with regulations absent in some states. An individual could work in one state and reside in another, both with different rules on tobacco use. While both of them had the same objective in mind, the varied approaches could interpret varied benefits for the residents in either of the states. However, the government hopes to straighten the approaches used by having a uniform measure employed by the different states. Every lawmaker or person knows somebody who they would not want to be diagnosed with lung cancer due to exposure to smoking that resulted from an experimentation he or she had after finding a peer smoking on his or her way to school. Having clear control of the same would ensure across different states, such that the parents will be in a better position to control their child's chances of being in contact with sources of such influence. Such are some of the factors that one ought to consider in deciding on whether to support the legislation. The primary message in this presentation has revolved around improving the health status of the population in the country, resulting from a more streamlined approach to take an initiative that most states in the country have already taken a stand for. However, the efforts have often not been as successful as they should be due to different approaches by various states across the country. Once the regulation is streamlined, the citizens will be in a better place to comprehend the rules across the state. Our primary goal would be to get everyone to learn of the adverse effects of smoking. Therefore, the legislators ought to focus on the importance of identical approach across the country and the health disadvantages of smoking while getting the public to stand behind them. Citizens respect a reliable leader who seeks to address the well-being of his or her constituents, regardless of the pressures from other participants involved in the issue. As earlier identified, there is without a doubt that tobacco companies will be very against the regulation. This could cause significant drop in revenue from sales. However, the legislators would receive praise from their constituents for upholding their well-being, which would in turn be a positive influence in their political career. The message sells itself. Whenever you are fighting for people's welfare, the legislators will receive the voters for support for the policy because of the positive effects on the overall well-being. For example, smokers would appreciate it due to its likelihood of reducing the amount they pay in fines for violations of policies they make not knowing about it in different states, while non-smokers would appreciate the reduced exposure to smoke, which they consider uncomfortable.